Hey everyone, welcome back to Tea with the Supremes. Julie here with Ebony, Cassandra, and Savannah.
Hey everyone.
Hello.
Hola. I'm working on my Spanish.
See, I was gonna say, you know Spanish.
Very nice, very nice. So this month is National Foster Care Month. So Savannah's going to lead this conversation and give us some insight into her personal experience, and we're just going to get into talking a little bit about foster care, and I'll let Savannah get started.
Well, I think that just sharing a personal experience because I was in foster care will just kind of shed light on how it could really happen to anybody. And growing up, I didn't really hear of anybody being in foster care, or people didn't really talk about it if they were. So it's just, I guess, a stigmatized topic, and it's just things that you hear of, but it doesn't really occur to you that it actually happens. I know, like, we learn about it, especially through our education, like the types of things that can happen when parents are not fit to take care of their children. But my personal story is, I guess, what we'll get into. I was in foster care. I don't exactly remember how long. It was less than a year, it was months. And it was when I was about 13 years old. I was living with my mom at the time. And I remember I was home by myself. My mom was living in like a very small town. So I'm from a very small town. And then she was staying in a smaller town about 30 minutes away from here. And I was home alone, and a policeman came to knock on the door, and I was scared and didn't open the door. And I called my mom. She also told me, "Don't open the door until I get there." And when she came back, the police came back soon after, and they explained that they were going to be taking me with them. And basically, I just had, a little bit of time to grab some belongings. I remember I was also really sick. I had a really bad cold. And so the policeman brought me to the town that I'm from, about 30 minutes away. That was the closest foster home. So they brought me to the top of the hill, and then the child protective service worker picked me up from there and brought me to the foster home. And I just remember them saying, like, "Oh, she has a really bad cold, like, poor girl, she should be taking medicine," all this stuff. So already I was like, "Oh, these people are judging my mom," like. And so I just remember, like, feeling like crap, so I just wanted to go to sleep. The first foster home I was in was with a pastor and his wife, and I was the only foster kid. If you have to go to a foster home, like, this one was amazing. They really, like, addressed my needs. They took me to the doctor to get, like, a full-blown checkup. I guess I should kind of go into why I got taken from my mom in the first place. My mom was a substance abuser. I'm not sure what her substance of choice was at the time, as her addictions have evolved over time. But my mom and my dad were going through, like, some custody stuff. My mom accused my dad of being a drug addict. My dad came back completely clean. My mom said a lot of things that they didn't allow me to stay with my dad, and most of it was untrue. And, like, I would have been way better off with him looking back. But my mom was a substance abuser, so my dad accused, "Well, if she's gonna say I'm on drugs, then you guys need to drug test her too." And it ended up being that she was on drugs. So I was taken to this foster home. They were amazing. I just remember, like, the only thing I didn't like about that foster home was the bus stop after school was so far away. So I was like, I didn't like living there because I had to walk so far from the bus stop. But I was a 13 girl, so that was my struggle. But the reason I had to leave that foster home is their daughter and her husband and their kids moved in, and anybody who lives in the house has to be background checked and all the stuff, which they weren't. So I had to leave. In the meantime, my mom was supposed to be attending rehab, and they gave her steps that she had to be accomplishing in order to regain custody of me. And I remember her, she couldn't, I don't know what it is. There's a time period when in the rehab where she had to be blacked out. She couldn't have contact with anybody and she couldn't do that. So she left. So I just started to harbor these really negative feelings towards her. Well, growing up, my mom was like my friend, not my parent. And so like I loved being around her. I could pretty much do whatever I wanted. So not being around her was horrible. And then I started to resent her because I was like, well, you just have to do this and you get me back. Why can't you do it? So I got taken from the first foster home and went to a second one. And I wouldn't say this was a nightmare of foster homes, but it was definitely nothing like the first one. In this foster home, I had to share a room with somebody else, which I wasn't I knew them, they're older than me, but wasn't really familiar with her. There was five other kids. It was like pretty much chore after chore after chore. You guys have to do this, keep the house clean. I would ask to like go out with my friends. No. I remember I started to rebel. Like I wasn't the youngest, but I was the youngest girl. And so all these girls were in high school. I was 13 in middle school, and they would like sneak out at night and go drinking with older guys. And I was like, Hefe, I'll go. So I was like, I went. I remember one time being a 13-year-old and getting pretty drunk and then coming back and we had gotten caught. So I was like trying so hard to be sober. I was like leaning against the wall as the foster mom was like handing it to me. And then after that, most definitely couldn't go out. And then this whole time, like they were trying to see if my grandmother was fit to become my guardian. She had lived in San Diego, so I was anticipating moving to San Diego. And then my aunt offered to take custody of me, and so after a couple months of being in the second foster home, I was able to go live with my aunt, but then she ended up getting a DUI. And so that's a big no-no. And so they told my grandma, like, either Savannah moves to San Diego or you move up here to take care of her. So my grandma left everything there and moved up here to take care of me. And I lived with her from then until I was 17 and decided to move out on my own. And my mom was never able to complete what she had to do in order to regain custody of me.
First off, just thank you for sharing your personal experience. I can't imagine even especially at 13, like that's such a pivotal time in your life to be going through that. But it just, speaking to your emotions when they first came to pick you up and how you were, your immediate gut reaction was, they're judging my mom. You know what I mean? That's such a heartfelt thing because every child is like, that's my parent. And then to transition from that to dealing with your mom's not doing what she needs to take care of you, that's just devastating. And that's a whole trajectory that a lot of kids probably experience.
Yeah, it was hard. It was like I went from being upset that other people were judging her to me judging her, because it's like, what the hell? Like, you just have to do these simple steps and you can't do it. But it's like going into my education. It's just so hard to, like, through our addiction course right now, like, we're learning, addiction is not a choice, it's a disease. People don't choose this. And it's like, I get it, but it's so hard living on the other side of it. Like, it's just hard to accept that.
Well, as a child, to try to be sympathetic to adult problems. You're a kid. You shouldn't have to be sympathetic to an adult problem. Like, you're a kid. You should be able to just be a kid, and you were not given the opportunity, really. I know they say that about a lot of things, but you were forced to grow up really early.
And it's like I went from foster care at 13, I got pregnant at 14, I became a mom at 15. So it's like those, and at 13, like I was rebellious. I was not doing well in school. I was getting into trouble. I snuck out of foster care to go drinking. ended up getting like after foster care, ended up getting pregnant. It's like just crazy how getting pregnant and becoming a mother, like my life it did a 180. Like I changed 100%. My I did grow up like my focus was my kid. I'm gonna do good in school. F you to everybody who thinks I'm not gonna go to college. And that was my motivation. All the people said you can't, you can't, you can't. I wanted to be able to say, look at me now.
First of all, thank you so much for sharing. Your strength is just, I know me personally, I wouldn't have been able to handle that. So your strength and your grace through all of it and who you are today, it's just incredible. So I'm curious, do you think going through that made you a better mother to your eldest child? Slash your littles, of course, your little babies.
Most definitely. Like I always told myself I will do anything to prevent that from happening. And it was like being a young mother when my son was born, they have like a social worker come into the hospital room to make sure you're fit to be a parent. And I was so scared. I was like, oh my God, already? Like they're already. And so I literally I was always like, I am gonna be such a good mom. Like I can make it past 13 with my son, like being a good mom. So I was like, as soon like I knew I wasn't gonna do anything to jeopardize being a parent to my children. And so like when my oldest son got to 13, I like, oh, off my shoulders. I made it past where my parents made it with me. So it was like, even though I knew I wasn't gonna do anything to jeopardize that, like it was just, and I've never really talked about that, but once he turned 13, I was like, okay, like I did it.
Well, because you hit that milestone that your parents weren't able to hit with you. So it's kind of like, I don't know, you seem almost like empowered by it, which is really cool.
The whole gaining strength and perspective out of everything, I truly believe in that. Even like the most negative of experiences, you can gain wisdom from. But I just want to second what Cass said. Savannah is such like a powerhouse of an individual. She runs her own business. She has 3 kids. She's getting a dual master's, and she had her first child at 14. So she's done all this, at a young age. And she's still like, you're very young for what all of the things that you have accomplished, and she's still killing it. It's really aspirational. It's really admirable. And like to do all that despite everything that you've been through, it's really impressive and it's really empowering. So I'm glad that you chose to share that, because I'm sure there's a lot of people in similar circumstances that don't have an ounce of the confidence and the encouragement. So I think it means a lot.
It was definitely important to me to be a good example for my son and now for all 3 of my kids. So I graduated with my BA, my cap, it says this is for you. And so it was just, I really wanted to signify like he was my motivation before for everything up until that point. And now everything I'm doing now, it's for all 3 of my kids. I just want them to have a good example, and I want them to know somebody personally, like who's gotten their degree, gotten their master's. Like I have acquaintances, I have people I know who have that education, but I don't know nobody in my family has this degree. Nobody in my family has gone to this point. So I just think like I have this one life, so I need to do as much as I can. I want to accomplish so much.
I have a question for you specific to foster care. So being in that experience, and you said your first experience was really positive and then the second one wasn't. If you're a foster parent and you have children coming in, especially at such like an adolescence or that age, especially if you haven't been in that situation when you were younger, what do you think that foster parents can best do to support kids like you to make sure that it doesn't set a negative path?
Well, I think just supporting them and being there for them and, kind of allowing them to maintain some sense of normalcy. In my first foster home, I was still able to see my friends. They let my friends come over. They let me go to friends' houses. They would talk to the parents and make sure they were okay and everything like that. But I still had someone with social life. And in my second foster home, it was like a slap in the face. I had nothing. I had nobody. I couldn't really do anything outside of that home. So it's just like that in itself was traumatizing. So just being loving and accepting and letting the kid be themselves to an extent, obviously there's things going on for that child that they might have been doing that are not okay. So, but there are things, just letting them be themselves to an extent that's still safe.
It took a moment. So I honor you sharing that most intimate part of yourself with us. And it explains so much of who you are. There is such a strength that we joke about as Supremes with you, but not to share all of Savannah's life, but Savannah gets up at this ridiculous amount of hours in the morning to find her self-care. She likes working out, dear God, for you people. She enjoys that early morning time and that dedication she gives to herself, for herself, and then for those that are around her. And I am always in awe of her. And I understand it better now, hearing, I mean, we knew this, but hearing this, I am just, I am so honored to be a part of your circle. I thought about, well, that's not true, not I. My parents wanted to become foster parents, and because we were older, we all had to do the training with them. And I was just like, and I don't know if I could be that person. Like, I don't know if I could uproot my life like that and be, because that's a special kind of person. And I think as bad as we need adults and families that are willing to open their homes, we have to be more critical of the people that we allow to take in children in sometimes their most vulnerable states. So I hear you when you describe the first home versus the second home. And I'm curious as to what would you tell your then 13-year-old self? What would you tell yourself to, I don't know if it's better prepare you, or what would you tell yourself in the journey, in the process, in that looking back on that scenario? What would you tell the next 13-year-old that might be listening? Like, what is it that you wish somebody would have said to you?
That's really hard. um, I mean, to make the process easier, I guess something that, I would have benefited from personally is taking the therapy seriously. Like as being part of a family core, it was something that was mandated for me to attend. And I didn't take it seriously. I didn't want to be there. I would just say what I felt like the counselor wanted to hear. I remember them asking me to draw pictures, and I despise art. Like I suck at it, and I didn't want to do it. And so I would just draw like very generic pictures, like a house with the sun in the background and grass. And it's like things I knew how to draw because I didn't. So just like opening up and talking. And I think if I would have taken it seriously then, I probably would have continued it. I would have seen the value in it from a personal perspective. Um, I know that therapy is beneficial. I know this from my education. I'm going to be a counselor, but I have not taken advantage of it and its benefits personally. And I know I could have used it as a 13-year-old. I know I can use it now as a 29-year-old. So I really wish I would have taken it seriously.
I'm really glad you spoke to just, I guess, your interactions with the the differences too between the foster care or your foster homes, because I think oftentimes largely foster kids are often deemed like to be troublemakers or problematic, and it's like people fail to recognize like what they came from and what they're experiencing, and that's why they're acting out, not because they're bad kids, but because they're a product of what they're experiencing and what they've gone through. So it's very likely, I mean, I don't know if this is the case, but it is possible that your second foster home was like, I gotta, rehabilitate these kids and give them structure and give them discipline, when that's really not what you needed. So it's important, I think, that you pointed that out, that it's really just kids need to be supported regardless of what age they are or how they may be acting.
Yeah, I mean, in the first foster home, the worst thing I did was tell them I was going to the movies, and I went to the arcade instead. Like, I didn't do anything to jeopardize myself being there, because I wanted to be there, because I was scared of the unknown. Also, where I live, foster homes are far and few between. So one of the options was I would have to go to a couple hours away to a new school, to a new everything. So that was very scary for me. And I remember them telling me, like, you were one of the best kids we've ever had. Like, you were so respectful. You listened. Like, I was on my best behavior there. And then in the second foster home was a complete opposite. I really didn't care what they had to say. I did whatever I wanted to do. They told me you can't dye your hair without permission from your mom. It has to be written. It has to go through this, this, and this. I'm like, okay, I'm gonna do it. Like, I went and bought hair dye myself, and I did it myself. So it's like I really didn't care what their rules were. I was gonna do what I wanted to do.
And I think that to both yours and Jules's point, that in regular parenting, in regular life, you don't parent your children the same way. You don't, if you have multiple children, you you find out early that your children have different personalities. Child one is nothing like child two. In most cases, there's always, outside things that, outliers, if you will. And that has to be the same attitude that you take into foster care. Remember the training, and it was several weeks of training we had to go through. Ours just happened to be through a Christian organization. And a lot of it, as I think on some of the trauma training that we've done in these instances, they were specifically children that come out of what was then considered traumatic, experiences. But when I heard you speaking, Savannah, this entire process is a traumatic experience. You are being, even if your mother wasn't doing the right thing, you are being ripped away from the only thing that you know. And it's the mentality that we talk about when parents are going through divorce, and you're pitting one against the other, and this is a 13-year-old child who is just getting into puberty and trying to figure out their own issues and their own body and their own thoughts. And here we throw this in the mix. And now, even though my mom is wrong, I have to defend my mom. And then, Savannah, which all of this leads to my question, what happened when that shifted and you saw, or whether you agreed with everyone else when you said that it was no longer just them, saying, attacking her or saying that she was wrong, but you shifted when you saw that she didn't do what she needed to do, not from knowledgeable you now understanding that addiction is a disease, but you then, what could we have done for you then, that in that moment of transition, when you understood that, man, she didn't do, I could only imagine, like, did she not love me enough? Did she not? What are the things going through your then 13-year-old mind? And what could someone like any of us have done to aid that transition?
I didn't learn until very recently that, I mean, I've heard it, addiction is a disease, but I've learned recently that addiction is not a choice. Like, people choose to use drugs, they don't choose to become addicted. So I think learning. I mean, I might not have been able to comprehend it the way I do now, but somebody trying to explain that to me, I feel like everybody was scared to talk about drugs with a 13-year-old. I only knew what was told to me. I wasn't allowed to have this open contact with my mom. My mom would never admit she had a problem to me. She's like a compulsive liar too. So I mean, my thoughts back then were, why are drugs more important than me? Why can't she stop? Why is not getting me back important? Why is this her first choice? Even now, I struggle with that, like, because how she's never admitted to being a drug user, like verbally, she's never said it. And so, as a mother now, I have to protect my kids and I keep her at a very big distance. If I feel like she's using or she's relapsed or whatever, have no contact with her. She's not allowed near my kids. Our relationship is very, very strained. So even now, I'm not able to accept that, addiction isn't a choice. And I still struggle with, and you're still choosing them out over your grandkids, not just me, but your grandkids too. Why can't you get help? Why can't you stay sober? You've been sober for a period of time. Why can't you maintain that? So I just really struggle. And I know going forward, it's something I have to work through before I ever consider working with people who suffer from addiction, because I would associate everything with them and I wouldn't give them the fair treatment that they deserve. And I recognize that, and I would never do anything to jeopardize my career or my clients, something I worked so hard for. So I know I have a lot of stuff to work through before I can address that population.
I think it takes a really big person to admit that too. You know that you don't want to harm anybody who's in that situation. So you want to do the self-work before you help other people do the self-work within that population. There's a lot of power in that, and that's very commendable.
Thank you. I mean, I struggle with it too, because my what was that class? The group lab, the professor was saying that, like, don't say you can't work with a population. Don't ever say you can't. I was like, what would he say? Just say you can't do it yet. And I was like, it's true. I just like I have it's in the far future because I have so much to work through before that's possible.
I just have so much respect for you, and I appreciate your willingness to share. It's like that's an intense life experience that, I feel like it's going to always be with you, and there's always going to be emotion, and there's always going to be a lot wrapped up in everything that you experience. And I like admire you and respect you so much. You've done incredible things so far. You're super young, so I know you're going to have so many more incredible things. So I just appreciate you, and I'm glad you were willing to share this with everybody.
Thank you, ladies, so much for your recognition.
We love you so much, Savannah. And
I love you girls too.
I love getting to know more and more pieces of you every time we talk. So
I'm trying.
I know. And for somebody who had to go through all of that, I can't imagine how difficult it is to open up to new people when you had to open up to two new families that you literally knew nothing about, and like we were saying, like that's something that gets carried with you, not just when you're a kid, but with you for the rest of your life. So we're for lifers, circle for life, supremes for life. So you better get used to us.
I'm actually okay
100%.
you all, so I'm good.
You're stuck with us forever. Sorry.
I'm good with it.
You're all right. No. I am in awe. I think there's a stigma around anything, but I think there is a stigma attached to, and I know one of the Supreme spoke to it earlier. There's a stigma attached to the child in foster care in any scenario. And I think as professionals going forward, that we have to keep in mind that there are some things that happened that are out of the control of this child. And we forget that these are children, these are people. And I think one of our group mentors has said, these are just little humans. Like they feel the same feels. They live, as Cass would say, they have the same feels. Um, they don't know how to process those feels. And if we're honest, as adults, we don't always know how to process those feels and those experiences and those things. And so I remember some of the kids that were in foster care, um, as an educator. And I remember educators saying, listen, take a little extra time. Some of the older ones, they would say, hey, because you can see when you're in the system looking at particular things, especially since I did special education, you can see it's like, take a little time and take a little extra time, because you don't know what that lived experience is like, because everybody is not going to be family number one like Savannah had, you know, versus family number two, whether you are burnt out, whether you have too many kids, the pressure. I can only imagine the pressure to take another one in and do another one and do another one. I have friends that are foster parents, and they specifically work with trauma, kids that have experienced trauma, mass trauma. And I had to be interviewed because I just happened to be one of the people that would be around them. I was just tutoring one of the kids, and I am in awe. I am in awe of it. I am in awe of the families that foster. And hearing your story, Savannah, I can't imagine. I can't imagine all the feels that you were feeling and not knowing how to process it. I can only describe it as being almost torn between the world that you had versus the world that's in front of you and what's presented. I'm curious if, and I don't mean this in a disrespectful way, but I'm curious, do you think you still would have experienced the things that you experienced, including getting pregnant at 13, had you not been in that situation with your mom?
So, had I still lived with my mom? Yes, because how I said, she would let me pretty much do whatever I wanted. Had I lived with my dad, no, it wouldn't have happened, but I feel like it happened for a reason. I don't know what path I would have continued down had it not happened, because it was such a pivotal moment that it really changed everything for me.
I just keep going. Like, I have a 14-year-old son who can't be responsible for a sweatshirt. And, they have times where they, think they're grown and they're not at all grown. So just navigating that, again, just so much respect, so much admiration for everything that you've done, that you've come through, and like just the person you are. I joke about Savannah being my clone because I'm like super driven and I have a lot of goals, and she's very similar. And I wasn't at her level. I don't feel like at her age, and I didn't go through all the things that she experienced. So I just think it's really important. I think it's really important that you gave voice to this scenario, just so people know that you can overcome, and you can not just overcome, but you can kill it beyond what people who didn't have negative experiences. You are beyond many people, and that's just a testament to who you are. So I really thank you for sharing this piece of you with us.
Thank you so much.
My little one's right here. Is everyone doing a segment, or are we just wrapping?
It doesn't matter. We can if you guys are ready. If not, I don't.
Yeah, I'm ready.
I'm ready.
Okay.
So I was looking into some of this, and mindfulness is actually something really good, not only for the caregivers, but also can translate into the way they care for the children. There's 4 mindfulness effects that Foster Adopted Kinship Family Services New Jersey.org actually outlines. So number 1, response, not reaction. Mindfulness allows you to create a space before reacting to solution, allowing you to respond in a thoughtful way rather than reacting. So when you sit down to dinner after a long day and your foster child is overeating, you can take a moment to breathe before reacting and saying something unhelpful. Number 2, thought awareness. So mindfulness can make you more aware of your thoughts as someone separate from yourself, which allows you to take them less seriously and leaves the stress response uninitiated. So as you're rushing to work and stepping into something sticky on the dining room floor, you may have the thought that you're a bad foster parent who can't keep the house clean. With mindfulness, you can see that this thought is separate from you, and it's not the truth that has to completely encompass who you are as a foster parent. Because I don't know a lot of parents who can keep their house clean 100% of the time without a maid. So throw that out there. Number 3 is emotional awareness. So because mindfulness increases your ability to exist in the present moment, it causes you to be more aware of the emotions of others. So if you arrive at the visitation and your foster child's biological mom isn't there, you can be less involved in your feelings about her biological mom and being more supportive of your foster child in that moment and their emotional responses. And then physical awareness. So mindfulness practice makes you more aware of your physical body. Being in touch can help you notice aches and pains and attend to them early, not only in yourself, but as well as your foster child. So if you are a caregiver, I would highly recommend starting to practice mindfulness because it's a great way for you to connect with your foster child and make their experience more beneficial.
Awesome. I appreciate you giving tips on both sides of that. That's really helpful. And Ebony, what do you have for our quote this week?
Okay, so my quote is from actually one of my favorite movies. If you've never heard of Michael Orr, he is was a football player. He played for the Ravens, and I think he retired with the Titans. But there was a movie maybe 5 or 6 years ago that came out called The Blind Side. And The Blind Side was about his life, well, loosely based on his life. And there's a quote from his adoptive mother. Her name was Leanne Tooley. And she said, families don't have to match. You don't have to look like someone else to love them. So please remember that family is so much bigger than those that you gave birth to or those that share blood. Because if anybody knows, the Supremes are definitely family. So
Facts.
reach out, reach out, reach out.
Preach, sister.
Absolutely. Absolutely. And Savannah, it's only fitting that you wrap up this session. So if you can close us out with some self-care this week.
Well, I'll keep it tied to the theme, I guess, with the foster care, self-care. So I think for being a foster parent, it's essential to engage in self-care because you're taking in a child with trauma by choice, and that can be a lot. So I think just, you know, allow yourself, you're going to feel like you need to, I mean, if you're a good foster parent, you're going to feel like you need to tend to their needs and be there for them and support them and love them, which can be draining physically and emotionally. So give yourself time to do something for you that doesn't involve being a parent. Let yourself loose a little bit. Go relax, get a massage, go on a walk, do something for you, and give yourself that time and that peace.
Treat yourself.
And that's also good modeling.
Yeah.
Excellent. So thank you again. I think this was a wonderful conversation, and I hope people get a lot out of this. And we appreciate our virtual Supremes as always. Thank you so much for being back with us this week. We hope everyone has an amazing week, and we will see you guys next week. Bye, everybody.
Bye.
Bye.
We out.